Good afternoon. This is Barbara Brandt, Director of the National Center for Interprofessional Practice and Education at the University of Minnesota. I want to welcome you today to another edition of Connecting at the Nexus focused on the COVID-19 pandemic response. Today we'll be hearing from colleagues at the Indiana University, who will be talking about taking it statewide, online IPE and assessment in a pandemic. And I am welcoming you on behalf of my colleague Gail Jensen, who is the current chair of the American Interprofessional Health Collaborative, and encourage you to learn more about AIHC and to become involved. So this series that we've been presenting over the last several weeks is web-based discussions, webinars, and forums to foster conversation, learning, and resource sharing among leaders in interprofessional practice and education. We do record and archive all of our webinars, and they can be found on nexusipe.org. And so that you can view it again, share it with your colleagues, and encourage them to learn more. So I'm going to turn the rest of this webinar over to Andrea Peifel and her team at IU, and then we will be taking question and answers at the end of their presentation. Thank you.
Good afternoon, everyone. It is a pleasure to talk with you about the work that we've been doing at Indiana University to continue our interprofessional education programming in the midst of COVID-19. What I hope you glean from this webinar is how really vital it is that each of us who are doing work in the field have ourselves positioned to have the resources, the personnel, the planning in place so that we can rapidly pivot when something such as the challenges presented by COVID-19 comes before us. Today, you're going to hear from can you advance the slide, please, Sean? Actually five of the IU IPE team, myself, Dr. Laura Ramito, Dr. Brittany Dalton, and Dr. Zach Weber. Each of them will tell you a little bit more about themselves when they present. This is the rest of our team, and the fifth member that I talked about that you're going to hear from today, you'll hear from on chat and possibly via audio as well. That's Jennifer Burba, who is our Deputy Director and is going to be posing some questions to you via chat and helping us to keep an eye on what you need to know from us. This is the rest of the team. You can see it takes a village. It really does to do what we do, and each and every one of them was really vitally important in the work that we did over the last 6 weeks. Today, we hope to discuss strategies for successful conversion in interprofessional education from in-person to online presentation and experience. We're going to describe faculty development approaches to support the transition and manage expectations. And we're going to demonstrate to you the learning outcomes that we achieved in the last few weeks in an immersion level interprofessional learning experience and compare those to what we typically see in our face-to-face events. And now just a little bit about our center. Located in Indianapolis on the IUPUI campus, we serve all of Indiana University across the state. And so we are physically located in one place, but we work across 9 campuses. We were established in 2014 by the president, the provost, the chancellor, and the deans of University Clinical Affairs schools, which is really 8 schools at IU. In addition, Purdue University was a partner in the early conceptualization of the center. We are charged, quite simply, to ensure that all IU health science, public health, and social work learners graduate competent to work in teams to improve healthcare, health, and well-being across the state. In addition, we have partners across the state. As I mentioned, we're located on 9 campuses. And so we have programming, the same programming across 9 campuses. Some of those campuses only have one of our schools represented. And so we work with Butler University, Indiana State, Ivy Tech, Manchester University, Purdue, St. Mary of the Woods, the University of Evansville, the University of Indiana, and the University of St. Francis to put our longitudinal curriculum in front of people. Teach or Team Education Advancing Collaboration in Healthcare is our foundational interprofessional curriculum. It is a building block. It is the first step in understanding how to work in teams and some of the basics of the interprofessional collaborative practice competencies. We launched a number of pilot initiatives in 2015 and 16, and then officially launched the longitudinal curriculum as it stands today in 2017. So we are in our third full year. When the center was founded, we in 2014, as I said, we basically had a budget for operations and to provide faculty leadership in key areas, but that was it. And I share that with you to say, to demonstrate really the extreme amount of support that we've had across the state to move this work forward in a very short period of time. The longitudinal curriculum basically is located at the places identified on this map. We do ground it in the interprofessional collaborative practice competencies. We've adapted them to, we, meaning our advisory board, has adapted those to meet the needs of our state with very small changes really, but it was important as stakeholders that they really process those competencies and determine which ones were priorities for our graduates. Our curriculum is designed around Indiana state health priorities, and that has become very important over time to demonstrate our importance to the state. We do address both individual and population health components, and it occurs longitudinally embedded within our learners' required course curricula for graduation in the program. So each year we have more than 8,000 health science learners move through our curriculum. This is just a framework of the framework of the curriculum. We start with an orientation that occurs uniprofessionally within the schools or programs to help learners understand what to expect and why we're doing this. And then they move into 4 discrete events. That's anchors 1, 2, 3, and 4. They move from exposure into immersion, which are into entry to practice. All of the learning occurs in the context of practice, just gradually moving more so from video vignettes and paper sort of cases early on through standardized patients and then into their clinical learning or experiential learning. The entry to practice portion of the curriculum is embedded within our learners' practicum, clerkship, clinical coursework. We use the Freeze-Kirkpatrick model to frame assessment of our learning outcomes. And so we look at satisfaction and reaction early on. We look at learning around knowledge that we think is important to be able to function in an interprofessional collaborative team. We look at demonstration of skills early and then in the immersion experience. And then we actually do direct observe each of our learners performing the interprofessional collaborative practice competencies at midway through the curriculum and then in the anchors 5 and 6. And so on March 18th or March 11th, when our team gathered in our conference room to prepare for working remotely, we were looking forward to 3 large-scale interprofessional learning events that were planned to occur across the state between April 3rd and April 24th. You can imagine the horror that we felt when we were trying to, at that point, didn't know for sure if we were moving into an online format, thought probably we were, and also looked down and realized we had not designed any of our learning specifically to occur in a distance format. Nonetheless, given our charge, it was really critical, we felt, that we deliver not just on time, but on par learning in a distance environment for our learners and keep them on track so that when they return to their educational programs, their interprofessional schedule would not be one of the many things that were being juggled in order to keep them on target. So today we're going to focus on just one of those learning events. You see it, the blue arrow is pointing to Anchor 4, integrating interprofessional collaboration. To give you a sense of what we needed to accomplish, we have, as I said, we do use the core competencies to frame our competency-based outcomes. These are specific learning objectives that we have highlighted as having to accomplish during that anchor. And you can see they are all behaviorally grounded. In addition to this, our 4th anchor does require us to assess readiness of the learners to enter the clinical or practice environment. So we typically have the facilitators direct observe each and every learner and give us an assessment of their ability to perform select competencies. And Dr. Dalton will talk more about that as well as Dr. Ramito in just a few minutes. And so now I'm going to turn it over to Dr. Weber, who's going to lead you through a very cursory overview of what we did to make this happen as a team. We're not sharing this with you to drag you through the details, but more so to give you a sense of the work that we were doing and hopefully raise some questions in your mind as to what it takes to move into this online environment, because I'm not sure we're going to be able to put all of these genies back in the bottle now that we have done some interprofessional work online. So as you have questions, please ask them in the chat format. And as Dr. Brandt said, she's going to help us filter through those. And also notice in the chat, Jennifer's going to post some questions for you to think about as well.
Perfect. Thank you, Andrea. So my name is Zach Weber. I serve as an assistant dean within the IU IPE Center. I'm fortunate enough to be part of Andrea's team to work on this statewide IPE curriculum that we have here. And then in addition to that, I serve as the director of IPE for Purdue College of Pharmacy and a clinical associate faculty member within their Department of Pharmacy Practice. And so if we go to the next slide. So when we started this process, the place that we started was really kind of thinking at a high level about what are some of the key considerations of things that we think about when we have to launch one of our live, kind of in-person, face-to-face events. And then now that we had to move that over into the online environment, what kind of things did we need to consider to make that transition as smooth as possible? And so in the left-hand column here, I have a list of some of the things, the main things that we considered that we have to put into place and to think about for a face-to-face event. And then in the right-hand column, what I want to do is kind of go through and discuss how those things either were or were not adjusted for the new online version. Next slide, please. So the place that we started, as you start with most any educational event, is with the learning objectives. And so as Andrea mentioned, we already had learning objectives and competencies that had been mapped to this particular IPE event. And so those learning objectives were already approved by all of our partners and represented certainly what we wanted our learners to achieve by participating in the events. And so really we placed an initial priority on designing an online version that would allow our learners to accomplish these same things, even though the way that they might accomplish those, they would might look a little bit different. And then after we agreed that we wanted to try to stick with the same learning objectives, then we began to look at who would be participating in this new online anchor and how that would compare to who might have participated in our face-to-face event. And so we needed to try to take inventory of all of our participating programs and our partners to identify if they were still available and interested for their faculty and their learners to participate in this same event when we move it online. Realizing that our partnering programs, each of them have a bit of a different requirement and a different emphasis on IPE within their curriculum. And kind of regardless of how that was initially, their emphasis and requirement for IPE may have changed in the setting of online instruction that came because of the COVID-19 restrictions. And then again, we had to start to think about when this online event would be offered. And so when our partnering programs would send us their rosters and list of faculty and students that would be participating, who would be included on those rosters and when would we like to receive those, so that way we could plan on our end how many students and how many faculty we would have participating in this particular event. And so we also had to think about our faculty to student ratios, and we typically have desired faculty to student ratios for our face-to-face events. And then we needed to decide, did we want to stay with those same faculty to student ratios for the online event, or could that be adjusted in some manner, realizing that the method of instruction would be different? So we had to start to think about in this setting of who would participate and how would they participate. Next slide, please. The next thing that we thought about then was the online pre-work, right? So leading up to each of our anchor events, we ask our learners to do some level of pre-work that's in the online learning management system. And so the advantage that we had is that we already had a bit of a structure in place and that we had our pre-work built into the learning management system. And so we could use that same platform for the online event and any pre-work that would be associated with it. We did need, of course, to review the content that was part of that online or that pre-work online and update it based on some of the new considerations. And that is, for example, that the students would now be using the LMS as the basis for connecting with each other and having conversations with each other. Whereas before, they likely would have worked individually through that pre-work and performed more of a content review, whereas now they're going to be performing a lot more tasks within the LMS itself. We also needed to be considerate of how long the pre-work would take. And we wanted to make sure that the pre-work that we did for this new event was going to be consistent with the prior time expectations that we would have for our learners. And then, of course, we would have to update the online content to reflect any changes that we might make to the background reading or the patient case or other information that might be revised in the new version of this event. Once we got past that online pre-work, then we had to start to think about the actual in-session information. So the patient cases, oh, I'm sorry, I'm still on the previous slide, if you don't mind. Thank you. So we had to start thinking about the in-session information and the patient cases that we would use. And so what we decided for this is to actually take advantage of an existing patient case that the students had already used as part of an earlier anchor event and just expand it with some additional characteristics that were relevant to this new event that we were focusing on. So the students were already familiar with this patient, and then us at the IPE Center, we already had relevant information about this patient that we could integrate as part of this anchor. So rather than trying to recreate and redevelop a patient from new, we could simply expand upon an opportunity that we already had available in the center and expand upon some files that we already had as part of our archives. The other thing is we viewed this opportunity to move the event online as an example to update some of the patient case content. And we actually chose to incorporate certain aspects of COVID-19 into the IPE event itself. And so, of course, that was the reason why we had to move this anchor online to begin with. And so it made sense to us to try to incorporate that into the case as a way to make it relevant and realistic for our students. Next slide, please. And so then after we got through some of the in-session information and decided kind of at a high level what we wanted the case to be about, we had to start to think about how we were going to bring our students together. And so we needed to figure out how we were going to group them together in this new online environment, meaning how many students were we going to have per group? How many student groups could each faculty member evaluate or be responsible for? The other thing, as Andrea mentioned, is we have 9 campus locations across the state in which we offer these events. And so with multiple campus locations now participating via distance, we actually had an opportunity here to combine students from multiple campuses together to participate in a way that we wouldn't have otherwise had to or been able to do for the live events. And we could maybe more equally distribute learners and better represent professions in some of our interprofessional groups. And then, of course, we had to think just logistically, how are we going to navigate the approximately 1,800 students that we are going to have enrolled in these anchors and put them into their groups within the LMS platform, and making sure that we can try to limit the amount of information that would be viewable by faculty and by students as a way to try to minimize confusion, meaning that we only wanted them to kind of have access to the information that was necessary to their group and to their event and to their faculty member. And just logistically, what would all of those things begin to look like? Next slide, please. So as Andrea mentioned, in this Anchor 4 event that we're discussing today, one of the key focuses of this event for the in-person session is that it involved a meeting with a standardized patient. And so our students would be assigned to small interprofessional teams, and they would complete a visit or an interview with that standardized patient. And so we wanted to try to maintain that important aspect of this anchor as much as we possibly could. And so the in-person encounter for this particular event was converted to a videotaped encounter, meaning that our standardized patient actually submitted a kind of a video vignette of issues that were important to them related to the situation that they were in. And then again, what we did is we actually, used kind of real-time COVID-19 restrictions and COVID-19 considerations as the basis for the video that actor presented. And we used that as what the students would use to kind of complete their piece of this activity, as opposed to them having to meet with the patient synchronously. We found that there was a lot of logistic difficulties associated with trying to offer live synchronous interactions between the students and the patient. And we didn't think that it was possible for the students to all meet synchronously with a standardized patient as part of this activity. But what it was possible was likely for them to meet synchronously with each other. And so what we did is we allowed the student teams to interact with each other synchronously, and they could choose whatever method of interaction that they wanted, whether it be via Zoom or FaceTime or something else. But we wanted to give them that flexibility to interact with each other and try to minimize the logistical difficulties of having to interact with the patient themselves. So the second key part to this activity when we did the in-person event was the faculty-led debrief. And so following the interaction with the standardized patient, then faculty would traditionally go in and conduct a debrief session with them. But we realized that, again, logistically, doing a live in-person faculty-led debrief was likely not feasible given the constraints that we were working with in the online environment. And so what we did to try to overcome this is we converted the faculty debrief guide that we previously used into a worksheet that had guiding questions that the students used to basically complete a peer-led debrief. And so the students had to work through a worksheet to complete reflective type questions so they could discuss synchronously with each other the types of things that we would ask them to consider during a traditional debrief. But essentially what it did is it became a version of an asynchronous debrief with the faculty, meaning the students completed the debrief worksheet together synchronously, and then the faculty went back asynchronously to review that worksheet and provide comments back to the students. And so the faculty evaluated that worksheet, and we actually had the students submit it in the LMS itself. So that way the grading function that was in the LMS made it very easy for faculty to review the submissions from the students, mark them as complete, and provide comments that could directly be sent back to the student groups. And then outside of the LMS, we asked the faculty to complete a very brief Qualtrics survey that allowed us to gather a small amount of objective assessment data just to kind of try to document how well the students were completing their reflection and how well they completed that debrief guide. And so those were the two main things that we did to try to keep our assessment in place. And of course, Dr. Dalton will be talking more about our assessment results as we go forward in this presentation. The last main thing that we had to think about kind of at a high level was the event evaluation and feedback. And so this was something that was important for us to gather from our students during the face-to-face events. And since this was already an electronic process and was done via electronic survey, we essentially used those same survey links that were done during the in-person events and converted them over into the online events to gather essentially the same type of event evaluation and feedback from the students as what we would have previously achieved. And so after we went through the kind of this planning process of converting over the in-person considerations into the online event, if you want to go to the next slide, please. Then what we did is we developed a work plan. And so Dr. Dalton actually, as kind of the director of our Teach curriculum, she developed a work plan that began to dive more into these logistics. And we began to think more specifically about all of the things that we would need to accomplish, and then importantly, who would accomplish them. And so she kind of divided this into three main areas. And so we had a work plan that was developed into all of the things that we needed to think about to successfully navigate student participation in this event. So these were things like, what dates would this IPE module be available open online? How would the students get access to the learning management system? How would we complete all these group assignments, and how many students would be in the groups, and so on and so forth. We then moved over into some of the faculty consideration and logistics, with an extremely important one being faculty or facilitator development, which Dr. Ramita will talk about here in a little bit. And then only as what's the timelines as an interprofessional team, what are our timelines along the way to make sure that we can have everything successfully launched in time. Next slide, please. And so outside of some of these logistics, there was a few kind of overall considerations that I think allowed us to be really successful with this conversion to this online event. Number one is related to the content of the event itself, right? So we had this overall goal of we wanted to make it realistic, we wanted to make it meaningful, and we wanted to make it current for our learners. And so the two key things that we did with this is we included aspects of telehealth into the IPE activity itself. We asked the students to reflect on that. Obviously, they were meeting via telehealth capable function or telehealth capable capabilities. And so we wanted to realize that that was a realistic way that health professional teams are meeting in current practice. And similarly, like I mentioned, we actually put in COVID-19 related considerations into the patient case, meaning that our patient was following local social distancing rules. They had difficulty getting to their doctor's office. There were different ways that they had to communicate with their providers. And so we thought that it could be very realistic if we put some of these restrictions into the actual simulated case for this event. Another thing that was extremely important for us is we needed to look at the personnel within the IPE Center. And we needed to look at what roles our team members were currently playing and see if we needed to assign or reassign them into different roles so we could meet the acute need of converting this over into the online environment. We wanted to make sure that we could take advantage of the strengths and backgrounds and availability that our members had to help us with the different aspects of this. And of course, think about other personnel that could help us. And so specifically, we were able to actually integrate some new campus resources and use some IT support related to developing our new LMS site that we housed all of this information on. And so it just became really important to take inventory of who was there on our team and how we could come together to help each other make sure that this event was successful. Next slide, please. And then the next thing, like I mentioned, what we did is we had multiple meetings and set different methods of accountability. And so there was constant communication back and forth between our team members. We had frequent staff meetings multiple times per week. We had status updates. We developed online chat platforms that we would use. We were in constant text message. And so we just developed all these mini timelines over the course of this process to make sure that not only could we stay on track, but we could keep track of what everybody was doing as well. And then as we began to develop the online LMS site, we wanted to make sure that we could have access to that to make sure that we could identify any glitches, any bugs, any issues, and make sure that we could kind of test that site before it was rolled out to our learners. Next slide, please. And then as a whole, you know, the last thing that I know I kept saying, and maybe to myself, but I also communicated it to members of our team, is that honestly, what we were able to achieve with this is quite extraordinary, in my opinion. And I really wanted them to be able to focus on the wins of everything that we were able to do in the situation that we were given. And so really what we did with this process that I just outlined is we were able to successfully roll out 2 statewide IPE events in basically under 3 weeks. If you look at the planning process that we went through, we successfully engaged approximately 1,800 learners across 9 campuses. And it was important to remember that while there were certainly a few issues that came up along the way from a technology or access thing, but that those few student issues, while they can seem daunting at the time that you're trying to navigate them, it actually represented a minority of those people who were enrolled in this event. And the vast majority of our learners and our faculty had a very positive experience with the conversion to the online anchor that we were able to roll out. And so with that, I'd like to hand it over to Dr. Romito to talk in a little bit more detail about some of the faculty development methods that we put into place.
Thank you, Dr. Weber. I am Laura Romito. I'm Assistant Dean for Faculty Development and Engagement at the Center, and I'm going to hit some of the highlights that we addressed here in this spring event. Go ahead, Sean, if you would. So this spring, our goal was to prepare 120 faculty facilitators across the state to participate in the Anchor 4. And as we began to develop the students' learning materials, as Zach described, our work plan, we also had to consider 2 things. One, how would the role of the faculty facilitator change in the online simulation? And 2, what would be the most efficient and effective method of preparing the faculty for these changes? So just like in the in-person event, and again, I've shown this as similar to what Zach did, comparing our in-person Anchor 4 to our online. So in both situations, our faculty are assigned to specific teams. However, their role and responsibilities were different in the online event. So in the in-person simulation, the faculty directly observed their team's huddle and interaction with the standardized patient. And during this time, they assessed their team's collaborative skills. And then as he mentioned, they debrief the simulation with their team. Well, in the online anchor, faculty participated only after the learner teams had completed their work. So faculty responsibilities involved accessing the reflection worksheet and the team huddle notes in the LMS, reviewing these materials, providing comments, and then using a reflection assessment scale, which we provided for them, to rate their teams based on the quality of their reflective responses in the worksheet. So to accomplish these tasks, we had to make sure that all the faculty had access to and knew how to navigate the LMS. This is a Canvas. Not all of our faculty use this LMS, and so many were actually unfamiliar with it. Faculty also had to understand the assessment scale and how to apply it, and how to access and submit their completed assessment online through a separate Qualtrics link. And in addition, Sean, if you would click now, we also had to manage expectations that some faculty had in regards to not being able to directly observe their learners. They were used to doing that, and that was something that some faculty had quite a bit of consternation about. Next, please. Now, typically for Teach Anchor events, the faculty development or preparation for their roles are going to be outlined here. And typically what faculty do is they're required to attend a live professional development session via Zoom, or at other times we've also conducted them in person. And for faculty convenience, several sessions are scheduled over the course of a few weeks at different times and days of the week. Faculty register online and then attend the session of their choice. And the sessions are usually about an hour long, and they review the anchor in detail, including the learning goals, the event activities, logistics, facilitator responsibilities, and skill development, and question and answers. And the sessions also walk the faculty through specific resources that are available to them in the LMS to prepare them for the anchor event. And they're expected to familiarize themselves with these materials in advance of the event, over and above what the professional development session offers. Attendance at these professional development sessions are documented so that faculty effort can be recognized at the end of the semester. We also, for Anchor 4, for example, do a 30-minute just-in-time faculty orientation on site just before the simulation begins to review the logistics and answer any remaining questions at the location that the anchor is going to take place. But this spring, due to the short time frame we had to work with, I prepared one pre-recorded podcast which faculty could register for online and view at their convenience. In addition, a faculty guide was developed. The guide was complementary to the information in the podcast. It was a document that faculty could download from the LMS, and they could use that as a tangible reference while carrying out their tasks. We also offered virtual office hours for faculty on 2 occasions. One before the assessment window opened, so that after they had completed the professional development session and reviewed the materials, before they started engaging with the learner materials, they could ask questions. And then we also had a virtual office hours after the assessment window opened, so that we could answer questions as faculty were carrying out or preparing to carry out their tasks related to the anchor. We were also available by email and phone just about at any time too. Next, Sean. So this slide just shows some key topics from the professional development podcast that was available for faculty. It reviewed the Teach Interprofessional Framework that Dr. Feifel showed at the beginning, talked a little bit about the pre-session or pre-work preparation learners were expected to do, and then delved into the event itself as it was restructured for the online environment, and focused finally on their roles and responsibilities in the anchor, which would be to access and review the team's collaborative work, provide constructive critique and encouraging feedback in the form of comments, and then rate or assess the team's collaborative work with the scale provided. And as I mentioned, we also had the faculty guide document, which provided a step-by-step guide to using Canvas, our LMS, and the speed grader feature in that system to complete the facilitator's activities. The guide also contained the assessment scale and a narrative on accessing reflections using the scale, as well as a link to the assessment portal in Qualtrics. Next, please. And you can just click through these, Sean, if you'd like. When the Canvas modules opened to learners, an email was sent to faculty facilitators by campus, communicating that their learners were able to begin the simulation and they would soon receive information on faculty development and other details for their participation. As the online anchors were closing for learners, faculty were sent another email with an attachment containing facilitator and team information, specifically their assigned teams, as well as the name and program of each learner in their teams. The body of the email contained instructions with a link to register for the Professional Development Podcast, as well as how to access the faculty guide. Information was included on how to obtain a Canvas or LMS account if needed, as well as dates and times and links for the virtual office hours that faculty could access if they had questions. I'd like to show you just a couple screenshots of what this looked like. This was the Canvas LMS, the front page or the home page of Anchor 4. And then what you see on the left there is in this LMS, you click on courses. All the courses that a faculty member has will pop up. And you can see the one in blue is the one that is highlighted there that a faculty member would click on to open up the Anchor 4 module for spring 2020. Next, please. This screenshot shows the speed grader. It shows actually a document on the left or something submitted from the team, the worksheet that was submitted from the team. And this is in the speed grader function. This allowed faculty to view and enter comments for each team submission automatically without having to manually open each submitted debrief worksheet. Faculty documented through that drop-down box there. They were able to document whether the assignment was completed and submitted. They just checked that drop-down box that you can see in the middle of the screen. And then in the box below, you can see that's where they would provide their comments in the form of feedback or constructive critique. Next, please. Thank you. This is the assessment scale that was used. It was a very basic scale, just describing underdeveloped, developing, or skilled in terms of the quality of the reflections that the team submitted. So after reading and providing comments on the debrief questions worksheet and the huddle notes, if they were submitted through this speed grader feature, faculty used this 3-point assessment scale to evaluate the reflection responses. Worksheet questions each represented a different IPEC competency area, and faculty were instructed to be sure that their rating for each team, 1, 2, or 3, was in alignment with the comments that they provided to that team. Next, please. Some considerations gleaned from this experience. I guess I can say these are the main things: communication, ease and convenience, and a heck of a lot of support. So you can never underestimate the importance of effective communication, particularly in an online platform. If that's the main way that you're communicating with your faculty, it has to be timely, very explicit and clear so as to reduce the potential for misunderstandings, and as brief as possible while still being complete in conveying the necessary information. I think it's quite challenging, but it can be done. Our goal was to make faculty preparation and participation as easy and convenient as possible for faculty. During the stressful time, we didn't want them to feel like this work was adding to their burdens already. In addition, we aim to always be available for support, even nights and weekends, to answer their questions. Walk them through step by step, one-on-one in some cases, and to do so with kindness and a collaborative spirit. We are all in this together, and we all had the same goal, which was to help provide a valuable experience for all of our learners. And that's one of the things I'm really proud of that we were able to do with this anchor. I feel like we were very supportive for the faculty as best we could be, considering how many we had to work with. And again, just like students, there's a wide array of faculty levels of comfortability with this sort of thing. Some needed no assistance, some needed a lot of hand holding. And with that, we'll hand it over to Dr. Dalton.
Thank you, Dr. Ramito. I am Brittany Dalton, and I am the director of the TEACH curriculum and also the director of research at the IPE Center at Indiana University. So in the interest of time, I want to kind of move through some of our assessment, really kind of hit some of the highlights so we can also make sure that we get all of your questions answered at the end of our time together today. So I want to talk a little bit about our assessment measures and kind of the plan that we used, once again, to transfer this from online or from face-to-face into the online environment, to talk about a few preliminary outcomes with you, and also during that to kind of compare those preliminary outcomes to outcomes that we see in our face-to-face events, and then share some key takeaways of our lessons learned and kind of those highlights of what's helped us to be successful. So thank you, Sean. So you can see here the objectives that Andrea shared at the beginning of the presentation, each of the objectives, and then in the face-to-face environment, the way that we would measure these objectives based on our assessment plan, which was also a graphic that was included in the presentation. So you can see here that we typically work with facilitator direct observation, which is a big part of our simulation activities. We also rely on student self and team assessment. So they are actually assessing the frequency of their own collaborative behaviors for themselves as well as for their team as a whole. And also we rely on the ICCAS during our curriculum and our measurement. So you can see here kind of our face-to-face measures that are typically used. And then we kind of, again, following our theme throughout the presentation, transferring these over into then the online environment. A big part of what we were trying to do, we don't ever do this just to check boxes so we can say, yeah, we did interprofessional education. They worked together. We got it done. This is great. This is a very trying time with a lot of kind of fluid issues. And so one of our main goals was that we were going to do this. We weren't going to do it just to say that we did it, but that we actually have data that allow us to look at our outcomes and what we were able to do during that online experience. So again, as Andrea said earlier, we do use the Freeth-Kirkpatrick model in terms of our assessment. So you can see here kind of the different levels that we were working to assess or evaluate during this experience, and then the methods with which we measured each one of these levels. So we'll talk about student self-report surveys, our continuous quality improvement data, as well as the student self-report of their self and team, their collaborative behaviors, as well as the ICCAS. And then we're also going to talk about those faculty assessments of the student reflections. So this is just a little bit of a breakdown of statewide, which professions and how many of each profession we have participating in this particular interprofessional experience. And then we'll start with some highlights about our student reaction level data. So this is our continuous quality improvement data. And what you can see here, we look at Canvas, we look at materials, we really look at kind of just their overall satisfaction with the experience and just really to gather their feedback in terms of their perceptions of their experience and their perceptions of what they've learned. So these items are measured on a 5-point scale. So 1 equals strongly disagree, 5 equaling strongly agree. And a couple of highlights here. So you can see the first column is going to be that spring 20 online experience. So amidst the pandemic. And then you can see our spring 19 and fall 19 face-to-face data for these exact same items as well. So a big takeaway for us here, you heard Dr. Weber talk a little bit about how we really looked at how could we use Canvas differently when the students are utilizing Canvas solely for this experience. We're not bringing them face-to-face, so Canvas is their main form of communication with their team and really for how they're gathering the information about the event, the instructions, as well as communicating with their team members. So you can see here that a big difference is how the students reacted to Canvas in both our online and our traditional previous face-to-face environment. So you can see a really big jump here in their reactions to Canvas, both in it contributing to their success and providing them new information and skills. Across the board, I think this is a pretty comparable experience. We see the evidence in the data here that this is comparable in terms of their reactions. And then overall, we're looking at just a very, very tiny difference in terms of how they rated their kind of overall satisfaction with this experience. Another piece of the student reaction is just allowing them to actually look at the learning objectives and report to us how they feel that they were able to achieve those objectives during their learning activities. Again, here, we're kind of seeing the same trends across all events. Still, the highest rated reaction or their highest kind of reported ability to meet those learning outcomes are those last two there, which both are talking about them engaging in self and team reflection and thinking about how what they learned is applicable to future practice. So across the board, we see pretty similar results here, but really want to highlight how in all three experiences, that reflective piece is really where they're rating their achievement of those objectives the highest. In terms of their acquisition of knowledge and skills, if we're looking, this is the ICCAS data that we collected. And again, you can see this across our spring 20 online experience, our spring 19 and fall 19 face-to-face, as well as preliminary, the number of students that we received data from. So a couple of highlights here. Across the board, we don't see a whole lot of difference in how big that change is, but we do see that in spring 20 that these students are rating themselves at a much higher level to begin with. But still in that after, although that rating is much higher, we're still just seeing about an average of kind of 0.5 difference in this change from before to after. I'll add that all of these were significantly different at a p equal 0.00 level from before to after. So students are significantly different for their competency after this experience than they reported they were before. And this is the same across the board for every single construct that is within the ICCAS, so communication, collaboration, roles and responsibilities, patient-centered care. Those were all significantly different from before to after for every experience. Next slide. Thank you. And so another piece of this acquisition of knowledge and skill is this self and team assessment. So again, this is where we ask the learners to assess their own collaborative behaviors, the frequency with which they display those during their time with their team, and also to assess their team for those same behaviors. So for this, you can see on the left-hand side, the mean of them assessing their frequency of those behaviors, which ranges from 0, which would be never, to 3, always. So for the spring 20 online version, you can see that they rated themselves on average at 2.55, which is somewhere around frequently to always. And then you can see that jump there for the team assessment. So they're rating their team's collaboration higher than their own collaborative behaviors. And we can see this happening, which is a statistically significant difference in both spring 20 and spring 19. And then in terms of looking at those behavior changes, and as Dr. Weber described earlier, looking at their reflective pieces where we were asking them to reflect on how this was applicable to their future practice, what they learned, what were the difficulties, and really asking them to look at how they felt like this experience changed their own practice. We broke those down into each of the competency domains and asked them to measure this on a scale from 1 to 3, as Laura showed, from underdeveloped to skilled. And we see across the competencies that the students did report somewhere between developing and skilled. Then that's the facilitators provided that feedback to them on each of those competency domains in terms of their reflective assignment that they turned in the learning management system. So again, really just big piece of all of this data that we're trying to move through quickly. What's really important here is that we did have to rely more heavily on student self-report due to the nature of the experience and the activities. We were still able to collect faculty assessment around the work that the students had done. But what's really important here is that we were able to gather this data in multiple ways, multiple measures, which allowed us to triangulate this data together, which provides a lot of reliability in terms of we're getting the same result across multiple measures. The question is asked in multiple ways, and we're getting it from a couple of different sources. But across the board, we're seeing that this is a comparable experience. The students are reporting that they're gaining knowledge, skills, they're gaining competency. And the facilitators are also seeing that they are becoming skilled in their ability to talk about how they believe that this knowledge, these skills, these competencies have changed from their interprofessional learning experiences. So we've talked a lot about these lessons learned throughout. So again, I want to make sure that we get your questions answered. So just very quickly, we really learned the importance of utilizing that learning management system differently when the students are collaborating in real time there in the learning management system. We learned about effectively creating student teams to open the lines of communication. Again, we wanted to, from the get-go, create this place where they could come and collaborate right then and there without this whole exchange of emails and having to kind of figure out how to communicate with their team. And so the learning management system really kind of takes a turn here for how to utilize it in order to actually achieve your learning objectives. It was really important that we were able to integrate the reality of current events into this scenario. Us educators, and we're not alone in what we're trying to do right now. We're being faced with taking what is typically face-to-face and putting that online, and many healthcare practitioners are doing the same. Interactions with patients or clients that are typically face-to-face are now also online. So this is a real challenge that many people are facing, and so to be able to implement this and to provide that experience to the learners was really important to us, and I think was a large part of our success. And then just utilizing assessment in the online environment. Again, we didn't want to do this just to say that we did this. We want to be able to say that we created a comparable experience both in the online and face-to-face environment. And that triangulation of the evidence is really important to us as we continue to take this data and use it as evidence to continue to grow what we've done online here, but also to take it into our face-to-face experiences to really maximize these opportunities for our students across the state of Indiana. So with that, I will turn it over to Dr. Brandt for some questions.
Okay, thank you, team. That was amazing. You've done incredible work in a very short period of time. I have to tell the folks who are on this webinar, there have been a lot of questions coming in, but what's been fascinating, the question that's been coming in, and you had already anticipated it. So many of the questions that are in the chat box, you've already answered. But I have scanned, and there was one question that was answered to that the panelists or the webinar participants did not see the question, but there was an answer. There was a thread that Kelly Lockman at VCU, Virginia Commonwealth, asked about. We have an interprofessional critical care simulation using high fidelity mannequins for small teams of nursing and medical students. It encompasses 3 2-hour sessions with 5 to 6 scenarios each. We're trying to determine how we might be able to do this activity remotely if necessary in the fall. The mannequins are presenting the biggest barriers. Are there any suggestions that you have?
Can you use an online simulation for what the mannequins would do? I have seen online programs. I couldn't tell you what they're called now because it's been a number of years, but basically it's almost like a video game in essence, but it's, you know, everything that would be happening with the mannequin would be happening in this program. And then individuals, typically I've seen that only used with one person engaging that program, but if there was a way that multiple people could do that, that would solve that problem.
So I would also say that 2 weeks ago, Creighton talked about, because they did a lot with simulations before, and they had to put them online also. There's one that just came in that's new. It says, did any students complain about doing the activity without a faculty member online with them? Did they feel they were abandoned having to do this without a faculty member to guide them, essentially?
So we did get some feedback from students, and really that was one piece of what their preferences would be. I'm very flattered by the fact that our students really want to do this face-to-face. They enjoy that interactivity. But I do think that the feedback they received from the facilitators did give them a little bit more of that human connection that they were longing for, and that they did get to hear from a facilitator. But that is something that a few of them mentioned, as well as they really wanted to be able to close the loop with the patient as well. But that piece of feedback from the facilitator, I think, was really valuable to the students. The other thing that we did to try to mitigate that was we had online office hours for the students. Our team wasn't super popular during those office hours, but we really did as much as we could to create that supportive and engaging environment, so that even though this looked a little different, that there was still that human connection, and they could ask real-time questions to real people if need be. Okay.
I'm mindful of the time. Somebody answered that iHuman may have a patient with a code event. Multiple events may be able to be prescribed by the faculty on the back end. Any other questions? There was one about the cost of platforms that we have not answered. So the question has something to do with looking for some cost-effective virtual platforms other than Zoom or Canvas. Any suggestions? I think most of us are now wedded to Zoom or Canvas, so by virtue of our institutions. But is there anything else you might recommend? I will recommend the University of Minnesota developed Flipgrid. Lots of people are using Flipgrid right now, including my 7-year-old granddaughter. She's quite skilled.
I wanted to share one comment back to the question about the student satisfaction and not having the faculty there. And when Dr. Romito talked about managing expectations in faculty, that was one of the things that was really a surprise to us. This was a much much more palatable way for faculty to interact with learners interprofessionally in terms of the amount of time it took them. But we really did have some faculty mourning that face-to-face interaction with learners. And, you know, even though, I mean, we feel like this is a success, a huge success actually, given the circumstances, but that sense of, you know, really learning about, from, and with each other is still something that folks really want on both ends, student and faculty.
And that said, we got some great suggestions too from faculty. I mean, and I said, look, in the amount of time that we had to prepare this and launch it, we were not able to ensure that faculty could be part of the team huddle or could listen in on that, for example. You know, maybe students could video their huddle and upload that instead of, you know, or with a document, but instead of huddle notes, maybe they could have uploaded a video. But again, you don't always know what the capabilities of all the learners are, or the faculty either, for that matter. So we tried to, with this initial event, make it as straightforward and as simple as we could in terms of burdens on either students or faculty. But we got some great ideas.
So I see that it is on the half hour, and here is the contact information for IU. This webinar, as always, will be put into our, is archived. Lots of people access it, but they also share it with their other faculty and staff colleagues and students to design their own programs. So this is the next, COVID will be next week already, and it's Kapow, Changing on a Dime, Successes and Challenges with Virtual Home Visits in the Jefferson Health Mentor Program. So that's a very well-known program that they had to convert overnight, moving out of the home. So we hope to see you next week, and send us any ideas, and thank you for participating, and thank you to the IU team. This was terrific.
Thank you for inviting us.
Thank you.
Thank you.